One of the initiatives we're embarking on is looking at home health monitoring for patients with chronic diseases. We started with heart failure. We're also looking at COPD, lung problems, and also with high blood pressure, for example. And so what we're looking for there is when the patient leaves the emergency department where I work or leave the hospital, how can we use technology at home, such as measuring the patient's blood pressure, measuring the heart rate, weighing the weights, and also some other kind of novel ability to detect issues, such as amount of oxygen. And if we can capture those data, how do we use remote health professionals to look at those data and support our patients? And how can patients also communicate with the monitoring clinician so that they feel safe at home, they feel that they can participate in self-management, and also have health professionals support them at the same time.
So this would apply to both children at home and seniors at home, or seniors in assisted living or long-term care.
So currently our project, our initiative, is focusing on seniors care, because at this particular time, and I work in an adult emergency department, in terms of cost curves for the health system, seniors with chronic diseases is a significant issue. But home health monitoring can absolutely apply to, for example, children care, can apply to obstetrics, can apply to mental health, a variety of activities. The case that we need to make is not only about improving patient outcome, not only about improving the end user's experience, the patient's experience, to make sure that they feel that this is helpful to them, but for our healthcare system and for our communities, from our governments, how do we use our healthcare dollars effectively? And so we need to develop a business case to make sure that it demonstrates that. So we have some preliminary data in our project to suggest that in fact it can have significant cost savings. And in fact, by having a certain period of protocol to clinically monitor these patients, it can help save government enough money to pay for our program 4 times over. And so these are the type of cases that will be very important, not only for the patient, not only for health professionals, but also for the health system, to make sure that this is an effective way to deliver care, so at the end of the day, we have excellence and quality of care for our patients.
Thank you very much, Dr. Ho.
Thank you.